I've learned how difficult loneliness can be.
So one of the most difficult things during this pandemic as a student was just a lack of connectivity. I am a resident of Houston who had to travel to El Paso for my medical education, and just the connectivity with my class, as well as just connectivity to the city, was a very big hindrance during this pandemic.
One of the most difficult challenges that I had to face as a medical student during the pandemic was having to separate myself from a large portion of my support group.
Working with patients that have not seen their family in months, those who have lost their loved ones, and those who simply don't have anyone is completely heartbreaking.
I think one of the most challenging things that students faced during this pandemic was the uncertainty of the whole situation. Our curriculum was changing, our schedules, our rotations, who we were allowed to see and weren't allowed to see as patients were changing.
Despite the pandemic and the catastrophe that was occurring, the medical community, as well as the healthcare community in general, banded together, fought this crisis head on, and it still continues to fight today.
One of the more uplifting things, though, during this pandemic that I saw was the fact that nobody was giving up. No one in the community and no one amongst the healthcare system.
One of the very uplifting things I noted was how much students and faculty were willing to sacrifice their time and resources to help patients and to help the community during this time. And this was very impactful and encouraging.
I became a little bit more aware of the flaws that were pointed out. Things like, the PPE shortage, the respirator shortage, as well as the fact that the public health system couldn't handle such a new health crisis.
I see clearly now how important it is that we be leaders in our community and models of appropriate behavior during health crises.
The identity of healthcare is still of service and compassion, and that has remained fundamentally true despite the pandemic.
Being able to vaccinate El Pasoans, getting vaccinated myself, educating on safety measures, and just going out there working at the bedside could have been seen as ordinary before the pandemic. And now it's something so extraordinary.
I think I gained a bigger sense of responsibility and a deeper sense of purpose and who I'm doing it for.